The new Roche SARS-CoV-2 rapid antigen test is an instrument-free, rapid diagnostic test for the qualitative detection of specific antigens of the SARS-CoV-2 virus present in the human nasal pharynx. The test kit is ready to use by healthcare professionals and consists of test devices, extraction buffer tubes, nozzle caps, sterile swabs, instructions for use, and the quick reference guide. Begin by carefully reading the instructions for use for the SARS-CoV-2 rapid antigen test. Use appropriate personal protective equipment and handle all samples as if they contain infectious agents. Before opening the test, check the expiry date on the back of the foil pouch. Do not use the test if the expiry date has passed. Now open the foil pouch and remove the test device and the desiccant package. Take a moment to ensure that the test device is undamaged and that the desiccant status indicator shows valid, yellow. When ready, insert a sterile swab into the patient's nostril and swab the surface of the posterior nasal pharynx. Rotate the swab 3 to 4 times and withdraw it from the nasal cavity. Place the swab into an extraction buffer tube. While squeezing the buffer tube, stir the swab more than 5 times. Remove the swab while squeezing the sides of the tube to extract the liquid from the swab. Now press the nozzle cap tightly onto the tube. You are ready to perform your test. Turn the tube and apply 3 drops of extracted sample to the specimen well of the test device. You can now wait for the test results. For accurate results, allow 15 minutes to read the test. Do not read the test after 30 minutes. A colored line appears in the top section of the result window to show that the test is working properly. This is the control line C. Even if the control line is faint, the test should be considered to have been performed properly. However, in both cases, the test is negative. If no control line C is visible, the test is always invalid. In case of a positive result, a colored line appears in the lower section of the result window. This is the test line T. Even if the test line is very faint or not uniform, the test result should be interpreted as a positive result. For safety, dispose all samples and materials used to perform the test as biohazardous waste. Testing ready to go when you need to know. The SARS-CoV-2 rapid antigen test.